Hello, I am Joyce Harper and I'm Professor of Reproductive Science at the Institute for Women's Health at University College London. And my new book called Your Fertile Years is published by Sheldon Press and is out in April 2021, but is available now to pre-order on Amazon. Each week, I am making a short video and writing a blog on globalwomenconnected.com about each of the chapters of my book. And this video is about chapter 6, how can sexually transmitted infections affect fertility? Now, you've probably heard of both of the terms, sexually transmitted infections and sexually transmitted diseases. And STIs is the correct term. It was in 1999 that the World Health Organization felt that infection was a better term because some of the infections do not lead to symptoms, whereas if we are using the term STDs, that would be when the diseases do lead to symptoms. So STIs is now the preferred term. In my book, I'm going to describe each of the STIs, their symptoms, diagnosis, and treatment, and whether they affect fertility. Now, there are 4 curable STIs: trichomonas, chlamydia, gonorrhea, and syphilis. And there are 4 STIs that are caused by viruses and are incurable, including HPV, herpes, hepatitis B, and HIV. So I'm just going to very briefly tell you a little bit about each one of these. So trichomonas is caused by this protozoan, and I'm not going to try to pronounce any of these names. It is the most common curable STI, and in women infects the vagina and the urethra, and in men affects the urethra, the head of the penis, and the prostate gland. And some of these infections cause a problem if the woman is pregnant or gets infected while she's pregnant. And TB is one of them. It may cause the baby to be born prematurely and have a low birth weight. And there is a link between TB and male and female infertility. Now, I'm sure you've all heard about chlamydia, and chlamydia is the one that really does cause a major issue to a woman's fertility. It's caused by this bacterium and is the most common bacterial STI, and it is transmitted through unprotected vaginal, anal, or oral sex. And the problem is that about half of the women that are carrying chlamydia have pelvic inflammatory disease, and pelvic inflammatory disease, or PID, can block the fallopian tubes and lead to infertility. And if this happens, the only way the woman could get pregnant is by going through in vitro fertilization, which I'll talk about in a few weeks. So it's really important to have chlamydia checks quite regularly for those that are sexually active, because it is a silent disease or infection. Gonorrhea is caused by this bacterium, and it infects the urethra, the vagina, the female reproductive tract, including the fallopian tubes, the womb, and the cervix, the anus, the eyes, and the throat. And it's transmitted by vaginal, anal, or oral sex, or by sharing sex toys. And it has similar symptoms, treatment, and outcomes to chlamydia. So this can also cause infertility. And syphilis. It's caused by this bacteria, and it's transmitted through vaginal, anal, or oral sex, but also by skin contact with the sores or rash, and by using sex toys. So this is one of the cases where using a barrier method of contraception, such as a condom, may still mean that you could get infected if you have sores that are not covered by the condom. And it can be transmitted from a mother to her unborn baby, but there's no link to infertility. So let's move on to the viral infections, the 4 viral infections that are not curable. We've got HPV. It's a group of more than 150 related viruses and is the most common STI. 80% of sexually active people will catch HPV at some point in their life, but for many, it doesn't have any symptoms or cause any problems, but they can affect different parts of the body. Some HPV variants cause genital warts, and there are 13 strains that lead to cancer, including cervical cancer in women or penile and anal cancer in men. And cervical cancer is the most common cancer in women under 35. So this is where women have a smear test regularly to check to see whether there's any issues. But there's no direct link to infertility. There is also a HPV vaccine, which I will go into in my book, but I won't go into in the video here. Then we've got genital herpes. This is caused by the herpes simplex virus, transmitted by vaginal, anal, or oral sex, or by close contact with someone who has the infection, including oral genital or finger genital contact. There is no link to infertility, but once someone's got herpes, they will have it their whole life. And if they have a flare-up at any time, they're going to be highly contagious. So it's something that if you're carrying, you need to be very, very aware of. Hepatitis is a complicated set of diseases. There's 5 hepatitis viruses, A, B, C, D, and E, and they have an effect on the liver, causing inflammation of the liver. And hepatitis B and C can be transmitted through sex, and they can cause serious illness and death. And there has been a link shown between hepatitis B and fertility. And HIV and AIDS. This is a retrovirus. There's 2 types, HIV-1 and HIV-2. And I'm sure you all know, but the final stages of HIV infection causes acquired immunodeficiency syndrome, or AIDS. It attacks a type of red blood cell called the CD4 T cells, and this has an effect on the immune system and causes lots of other issues. It's carried through bodily fluids such as semen, anal or vaginal fluids, breast milk and blood. There is no direct link to fertility and infertility, but if someone is very ill from their HIV infection or they have AIDS, chances are they're going to have some other issues that may lead to an effect on their fertility. So the basic prevention of all STIs, well, one way to do it is to not have sex, but I know that's not a realistic expectation. If you only have sex in a monogamous relationship, then as long as you're both clear, you will stay clear. That obviously using a condom is really important for people that are having lots of different partners or a new partner. But as I said, a condom may not prevent every single type of STI. And so what my recommendation would be, if that you are sexually active, that you are tested at least once a year for STIs, because some of them are silent. You just won't know that you've got them. If you're having multiple partners, or if you have any symptoms, and I go through the symptoms in the book, but some of them really can be quite problematic, then I would say go every 3 to 6 months to an STI clinic and have a check. Some of these, as I've said, can affect fertility, and it's better to prevent that rather than have to deal with the consequences. So I hope you found that useful. You can find further information about myself and the book on my website, joyceharper.com. And if you want to read a little bit more about STIs, I've written a blog, which is a short summary of chapter 6 on globalwomenconnected.com. Thank you very much.